Poso maoni wiak, waiwanan kitana ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your hosts, Gary Dodge
and Sheena Wapus. On this episode, we are joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. I would like to remind people that we request that you send in your COVID-19 related questions into us at podcast@mitw.org. Welcome, Vaughn.
Hello, guys.
So Vaughn, can you talk about the upcoming emergency order, or maybe what's going on with that this week?
Yeah, so Incident Command met this week, and we're putting out today, essentially, Order Number 9. It was approved by the legislature yesterday. What this does is it will essentially bring the tribal departments and various businesses in the community back to 50% capacity for running. An exception to this is the hotels. We've asked that they operate at a 25% capacity still for this time. Another major update with this is that the curfew that has been implemented on the reservation is going to expire. That'll be tomorrow on the 24th at 6 a.m. And so from here on out until or if cases spike again, we won't have a curfew on the reservation. That said, Order Number 3 with the mask mandates for anyone over the age of 5 or doing business in any of the tribal offices is still in place. Tribal employees will still be asked to, physically distance themselves from each other. And since, we're going to have employees coming back into the buildings, we're asking that they don't congregate in things like break rooms, just so we don't spread any sort of diseases and we can try to keep that, spread of COVID low. So in addition to staying out of the common spaces and stuff, we ask employees make sure they're doing their hand washing with soap and water, or using hand sanitizer when soap and water aren't available, and avoid large gatherings. It has been discussed that meetings and stuff will continue to be virtual even within the building, just so we don't get too many people in a space, since we do have kind of a high burden of COVID currently.
Okay, so with us going back, if the COVID spikes again, will there be a possible shelter in place, and will there be daytime curfew, and will the tribal police be enforcing it?
Yeah, so that is absolutely a possibility. Right now, the number of new cases has kind of leveled off. We're kind of maintaining a fairly high infection rate. But yes, if it increases from where it currently is, we could definitely see a shelter-in-place order that would be enforced by the tribal police and conservation, and that would entail curfews for daytime hours as well, and only restrict travel to essential things.
What is essential travel?
So essential travel includes things like mandatory travel for work, seeking medical attention or protection from law enforcement, obtaining food, showing up for any sort of mandated court appearances like jury duty. I'm not sure if they're running jury duty right now, but it would be jury duty. And then, if you are traveling, you really want to consider your transportation method and the level of risk that might be associated with that. Obviously, traveling in your car by yourself is probably your safest bet at this point. If you're with family and friends, it increases the risk level. Or let me step back. If you're with family in your immediate household, there's a slight increased risk just because you're still sharing the same air. If you're getting a ride from a friend, though, that significantly increases the risk because you don't know who they may have been exposed to. Also, public transportation, buses, airplanes, things like that, where there's a high degree of contact with individuals who are not in your immediate family, where you're sharing the same air, and have difficulty social distancing, definitely increase the risk of travel. So,
are the tribe's COVID restrictions for tribal members only, or are they in effect for everyone?
So technically, the tribe, as a sovereign nation, has jurisdiction over its tribal members, its tribal departments, as well as any tribally owned businesses. Or it also has influence over businesses on tribal lands. So can we technically say to the subway, "You have to do this"? There's been legal questions about that. We do know that, since they are on sovereign land, we can say, you know what, we have a mask mandate. There's also a statewide mask mandate. Your employees need to be wearing mask mandates. And if not, you can be subject to fines. So it does have limited jurisdiction over kind of entities that are in its sphere of influence.
So, Vaughn, are there places that are set up for people or for tribal members to isolate themselves if they become infected?
Yeah, the tribe currently owns, I believe it's 3 different houses that are being used as COVID isolation facilities right now. They can accommodate, I believe it's between 6 and, I'm going to say conservatively, 10 individuals per house. And they are being used right now for some of our tribal members that don't have the ability to isolate themselves in their home and recover. So, yes, we do have them. Yes, they're currently in operation.
Okay, and if someone doesn't go to another location to isolate, what are the best practices for them to protect other household members from becoming infected?
Yeah, so the CDC actually has recommendations out about trying to self isolate in your home. Uh, Basically, it means you're obviously restricting yourself and your movement in your house. If you have a bedroom that's kind of farther away from other places that are frequently used in the house, kitchens, living rooms, things like that, they'd like you to stay there. If it's possible that you can isolate yourself from a common restroom, they also recommend that. I know it's kind of difficult at times if you have either a large family or a small house to distance yourself from your families, but those are kind of the recommendations. They also recommend things like staggering times when you eat, so you're not sharing the same space at the same time. So yeah, you can go to the CDC website and check out more of that if you need any other additional tips or information. But that's essentially the gist of it.
So last week you talked about vitamins as treatment for COVID or possible like a helpful thing. Is that helpful for prevention for COVID? Like, is it helpful for me as a healthy person to take these supplements? I think you mentioned zinc and vitamin D.
Yeah, so we have talked about vitamins and supplements and stuff. Going to throw it out there right now for everyone that vitamins and supplements, they're not regulated by the FDA. They are not known to be a cure for COVID. That said, there is scientific evidence that talks about how various vitamins and minerals impact your immune system. They're still doing research into how those specific vitamins interact with and affect COVID. But they do know that specifically with vitamin D, if you have a deficiency, it leads to immune dysfunction. So it doesn't work quite as well. Similarly, zinc, if you don't have enough of that, plays a vital role in the signal pathway for how your immune system works. And so if you don't have enough zinc, messages don't get communicated through the immune system quite as quickly. And so it just affects your ability to combat the virus the way your body naturally would. So just saying, if you are immune or not immune deficient, well, if you're immune deficient, it's going to be hard on you. But if you're vitamin deficient or nutrient deficient, your body's going to have a harder time fighting off the virus. Ideally, you're either eating, fruits, vegetables, a nutritious diet that gives you that balance and blend of vitamins and nutrients that you need. If you are deficient or think you might be deficient, that's when you may want to take supplements. But, we can't say go out and buy supplements right now.
Okay. Is that maybe why some people seem to be like barely affected by COVID-19 when they're infected, or in contrast to people who get really, really sick? Is that maybe something that affects that?
That definitely could have a hand in it. To be honest, they don't know why, one person in a household may be completely asymptomatic, while someone has a really severe case. They don't know. They know that age and overall health have an effect on how well you're able to deal with the virus. It also deals with the specific type of strain of COVID that you get. They've found that the different mutations cause different levels of severity. And so you may just have a strain that is less problematic for your body to fight off. But they don't know yet. They're still trying to nail down why some people deal with it so much better than others.
Yeah, because I've definitely heard stories of, like you said, members of the same household. One person gets sick, they basically don't experience any symptoms at all, and then another person gets like pneumonia and has to go to the
Right.
hospital.
Right. And they've had patients that are, in their 80s and 90s that fight off the virus just fine. And when in contrast to that, we've had individuals in their 20s, 30s, and 40s that have passed away from it. And so there's still a lot we don't know about the virus.
So I think it was last week, the days kind of blend together, but I think it was last week, in one of the videos from the MTL members, it was mentioned that the reservation has the highest burden of COVID-19 cases in the state. Has that improved this week or stayed the same?
So that would be correct statistically. Right now, we have the highest number of COVID-19 cases per 100,000 individuals. We obviously don't have 100,000 individuals that live on a reservation, but that's just kind of the statistical benchmark for how they track things like this. And in addition to that, the surrounding counties are also extremely high right now. So we have 5,612 cases per 100,000. Brown County has 5,376 cases per 100,000. Shawano has 5,170 per 100,000, and so does O'Connell County. So it's not like we're this isolated pocket of disease. It's kind of diffused around us, and it is high in this area right now. Now, that said, Milwaukee and Brown County have had the highest total number of cases overall. And in addition to that, Milwaukee, Racine, and Waukesha counties have had the highest number of COVID-related deaths. So we haven't had any COVID deaths on the reservation right now. We have had tribal members that have lived in other counties that have passed away from it. But we haven't had any deaths in our immediate vicinity. We'd really like to keep it that way. And that's part of the reason we're trying to keep the spread as low as possible. Because even though they're finding that the fatality rate has decreased from what we initially estimated, it still opens the possibility up for people having to fight this off needlessly and potentially passing away from it. So that's why we're trying to keep that low. In that same vein, because the burden of COVID has been so high locally, places like Theta Care and Shawano are having a shortage of hospital beds, essentially. There's only, I believe it's 11 to 15% ICU availability for people that are really stricken with COVID right now. So I believe they only have like 5 beds left that they can devote to COVID patients. And so that's part of the reason we also need to keep the spread as low as possible, because right now, if it is bad for you, there aren't many places you can go. It's part of the reason why the governors opened up a field hospital, and I believe it's called West Alice. But that is given to patients under very strict criteria. People essentially have to be able to use restroom facilities on their own. If they're older or diabetic, they have to be able to administer insulin to themselves, and they can't have any supplemental oxygen requirements. So it's basically like a post-acute facility. So if you're recovering, not fully recovered yet, then you could go there. And the reason they did that is to, open up beds in those hospitals for the more acute cases. So long-winded answer, yes, it's kind of true right now.
Okay, so was there anything else you wanted to leave as a final message?
Even though the curfew is being lifted, we're asking people to please use their judgment as they move about the reservation, and consider limiting their interactions with other households other than their own, so that we can keep COVID as limited as possible on the reservation. We'd really like to make sure that we have as many community members survive this as possible.
Thank you, Vaughn.
You bet. Thanks for having me back.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn, and we welcome community questions you have regarding COVID-19. So please send those to us via email at podcast@mitw.org.